Hello, my name is Michelle. I'm a licensed acupuncturist and I work in admissions here at Finger Lakes School of Acupuncture and Oriental Medicine in Seneca Falls, New York. Today we're going to talk about acupuncture. What is acupuncture? How does it work? What can it treat? And more. Acupuncture is part of the ancient medical system from China called traditional Chinese medicine. It has an extensive history of clinical practice and scholarship that has been practiced for roughly 2,500 years. It is the longest continuously practiced system of healthcare in the world. Acupuncture involves the insertion of very thin needles at specific points on the body in order to treat a wide variety of conditions, such as pain, digestion, infertility, to name a few. Acupuncture is based on the concept of qi, which is a Chinese word that translates roughly to energy. Qi is responsible for all the change in the body. It's an important concept that is involved in maintaining good health. In Chinese medicine, there are channels or meridians that cover the entire body. The channels are both superficial, on the skin surface, and deep at the organ level. Each channel connects to the next channel in a continuous loop. In a healthy person, qi flows through the channels in an uninterrupted fashion. However, when a person experiences pain or illness, this can indicate that the qi is stagnant and is not flowing smoothly through the channel like it should. Acupuncture points are areas where it is easiest to access the qi in the channels. There are hundreds of acupuncture points on the body. In Chinese medicine, inserting a needle into specific acupuncture points helps the qi flow smoothly again, like giving it a little push. Restoring this balance to the flow of qi reduces pain and many other symptoms. Acupuncture points that are located in areas distant from a patient's pain are often used in treatment. In other words, an acupuncture point does not need to be next to or on top of a patient's painful area in order to be effective. This is because in Chinese medicine, all parts of the body are interconnected, and pain in one area can impact channels in distant parts of the body. As a result, use of distal points is quite common in treatment. There is not a simple biomedical explanation for how acupuncture works, which may lead scientists to question its validity. However, it has been determined that acupuncture needling creates a cascade of effects across multiple body systems, including the nervous, muscular, vascular, and endocrine systems. Research has shown that acupuncture can change blood flow, nerve conduction, endorphin release, and hormone levels. Functional MRI studies have shown that inserting a needle into an acupuncture point on the foot, which is traditionally used to treat eye disorders, causes areas of the brain to respond that are associated with the function of the eyes. This is particularly interesting because the location on the foot has no nervous or vascular connection to the eye to explain this effect. Acupuncture can help treat a wide variety of conditions. It's frequently used to treat pain of all kinds, including but not limited to back, neck, knee, and shoulder pain. It's also used to address pain from headaches, arthritis, fibromyalgia, and motor vehicle accidents. Other commonly treated conditions include infertility, anxiety, insomnia, nausea, stroke recovery, addictions, menstrual and gynecological conditions, and much more. Acupuncture needles are incredibly thin, about the width of a human hair. Sometimes patients may feel a slight pinch as the needle is inserted, but often patients feel nothing at all. Once the needles are in, they should be very comfortable. Most patients rest peacefully or take a nap while the needles are in. Acupuncture is typically a very relaxing experience. Numerous studies have shown that acupuncture is both safe and effective. Acupuncture has a very low incidence of side effects. In addition, it's a Food and Drug Administration regulation that acupuncture needles must be pre-sterilized, single-use, and disposable. This means that acupuncture needles are disposed of in the proper biohazard containers and are never reused. Most new patient acupuncture treatments begin with an extensive patient interview that can take from 15 to 45 minutes. The acupuncturist will ask a variety of questions about the patient's general health, including questions that seem unrelated to the condition a patient would like treatment for. For example, if a patient wants acupuncture for elbow pain, it's not uncommon for acupuncturists to ask questions about the patient's digestion, energy, and sleep, in addition to asking about the elbow. The reason is that acupuncture takes a holistic approach to diagnosis and healing. Holistic, meaning that the acupuncturist wants to understand how a patient's body is functioning as a whole, instead of addressing only isolated symptoms. After the intake, the acupuncturist takes the patient's pulse. The acupuncturist will take not only the pulse rate, but will also feel for the quality of the pulse. For example, the pulse may feel full or thin, string-like or slippery. Different organs are represented in different pulse positions, and the pulse quality can help the acupuncturist make a diagnosis about those organs. Acupuncturists also ask to see the patient's tongue. They're looking for the color and shape of the tongue, as well as the color of the tongue coating. As with the pulse, different organs are represented on certain areas of the tongue. Information from the tongue and pulse both aid the acupuncturist in making a diagnosis. After the intake, tongue and pulse, the acupuncturist puts the needles in and the patient rests quietly for about 20 minutes. Then, the acupuncturist takes the needles out, discusses how the patient is feeling, and the treatment is over. Moxibustion, or moxa, is a heat therapy commonly used by acupuncturists. It's made of the Chinese herb ai ye, or mugwort. Moxa is used for a wide variety of conditions, but most commonly joint pain that becomes worse in cold, damp weather, such as arthritis. It can also be used to treat digestive and menstrual disorders, among many other symptoms. Moxa comes in many forms, but it is most commonly shaped like a stick or a cigar. One end of the moxa stick is lit, and the moxa is used to warm up different acupuncture points or needles. The moxa does not touch the patient's skin. Moxa can also be rolled into a ball and set on the head of an acupuncture needle. Because metal is such a good conductor of heat, the needle conducts the warmth from the moxa down the length of the needle deep into the muscle to provide relief of muscular tension and pain. Herbal medicine is another important component of traditional Chinese medicine. It involves the use of various materials, usually plant-based, to treat a wide variety of conditions. There are over 6,000 materials that are considered herbs. Most common are plant products such as leaves, roots, bark, flowers, and berries. Occasionally, non-plant materials are included in herbal medicine formulas, such as minerals or animal products, although these are less common. Herbal medicine is usually ingested as a tea, traditionally referred to as a decoction. To make a decoction, raw herbs are boiled in a pot with water, and then the herbs are strained off and the remaining liquid is consumed. Herbal medicine can also be consumed in powder form or as pills or tablets. Herbal medicine functions along the same theories as acupuncture. The purpose of taking herbal medicine is to balance qi and regulate the body's functions in order to restore health and wellness. Acupuncture is one of the fastest growing healthcare professions in the U.S. today. One important reason for this is the increasing body of research demonstrating that acupuncture is effective and safe. In addition, there has been an increased demand from patients for preventative and holistic health care. Patients are looking for health care to help them prevent injuries and illness, as well as health care that addresses the root cause of a problem, as opposed to addressing only symptoms. Acupuncturists practice in a variety of settings. The most common is private practice, in which the acupuncturist owns and runs his or her own business. Many acupuncturists practice in multidisciplinary centers with other practitioners, such as chiropractors, massage therapists, or physical therapists. Acupuncturists also work in hospitals, spa settings, or as associate practitioners for other acupuncturists. The Finger Lakes School of Acupuncture and Oriental Medicine at New York Chiropractic College offers a Master of Science degree in acupuncture and a Master of Science degree in acupuncture and Oriental medicine. Both programs prepare our students for professional clinical careers in private and public health settings. Our acupuncture education includes extensive hands-on clinical training through all 3 years of the program. Both degree programs include a substantial focus on Western biomedical courses, including anatomy with cadaver lab exposure, physiopathology, pharmacology, and research. Training in the basic sciences prepares our graduates to help manage patients' healthcare along with other conventional healthcare providers. Prerequisite requirements for applicants to our master's programs include completion of at least 90 undergraduate credits, 9 credits from bioscience classes, and a minimum GPA of 2.5 on a 4-point scale. The Finger Lakes School of Acupuncture and Oriental Medicine has an exciting elective class in which students travel to China to study acupuncture and Chinese herbal medicine at a hospital. This class is led by experienced faculty members who are fluent in Chinese. It's an inspiring opportunity to see how acupuncture and Chinese herbal medicine are practiced in their native culture. We invite you to visit our beautiful campus in upstate New York to see our hands-on anatomy facilities, extensive herb garden, and on-campus student clinics. We offer free transcript evaluations to let you know whether you meet our prerequisite requirements. If you meet our prerequisites after the transcript evaluation, we're happy to waive your application fee. If you'd like a transcript evaluation, have questions, or would like to set up a campus visit, please don't hesitate to contact me, Michelle, the Acupuncture Admissions Counselor, at 315-568-3044 or mgrassick@nycc.edu. Thank you.